Welcome to the year-end module. Welcome to the year-end module. We discuss very important health aspects in vegetarianism, which is totally prevalent in our society. And unfortunately, I note as a clinician and professor that there are more myths than the facts. This is an effort to sensitize and empower the people to use the vegetarianism with supplement or restrict the disadvantages they are having in adopting pure vegetarianism. In this learning module, we will identify the key macronutrient deficiency in pure vegetarian's diet, understand the clinical manifestation and long-term health risk. That is very important. Long-term ones. We want to prevent that. Second is recognize the vulnerable group who are having the risk far higher than other population, and for them we have to have a risk assessment strategy which should be useful at the public health point of view as well as individual. And lastly, we will discuss the evidence based counseling. This is very important, and I expect my postgraduates who are seeing this video to learn it. And supplementation protocol, they must educate their patients so that in larger sense the public benefits. Pure vegetarian by definition is very varied. There can be no meat, no poultry, no shellfish. There is another group, it adds there is no eggs also. One group again coming that there will be no dairy product also. Then another group comes, even honey, insect derived ingredient they don't take. But the commonest thing which is they take these things only: grains, legumes, nuts, seeds, vegetables, and fruits. Mostly it can be balanced by this also, but with lot of effort and counseling is required. So we tend to emphasize that the vegetarianism in whatever source, it needs to be addressed with the scientific knowledge for better health benefits. Critical micronutrient deficiency is the B12 because it is found only in animal products. Few vegetarian people accept the yeast based B12, which is far costlier, 3000 times costlier than animal based B12 tablets. And they are very less available in the society also. That is why again a challenge. It is in many of the studies 50% of the vegetarians have got the B12 deficiency, and there is the identified need that these people should be educated how to better it. Iron deficiency, in total plant there is limited available, but it has got the phytates association which further limits the bioavailability of this iron, and further too it causes the health concern. Calcium, except for sitafal, no rich source of calcium is known for the pure vegetarians. And that is why the recommended daily allowance of 1 gram to 1.2 gram by vegetarian diet is little difficult to achieve. Vitamin D, again plant-based food, it is far more. And the people who are only vegetarian, they are dependent on the sun exposure. So this is the thing which is far less than the required daily allowance. Zinc, low bioavailability plus phytate zinc complex again causes less available for the vegetarians. Second issue, it gives some immunity benefit. If it is less, the immunity is compromised. Iodine, the limited plant sources. Only one rich plant source which is known for the iodine is the seaweeds. But the people who are in landlocked areas in Bihar, UP, Madhya Pradesh, they can't get this seaweeds. And that is why the low iodine availability causes poor thyroid function. Omega 3 fatty acid is required, which causes essential fatty acid deficiency and other hormonal problem. Further to it causes heme synthesis pathway dysregulation, and it causes the problem. Riboflavin, which is a very one important one, it causes glossitis, scoliosis of tongue, and otherwise it is without dairy it is far difficult to get this in required daily allowance, which is quite high. B12 is a critical concern because there is no reliable plant source that we have to understand. And how does it cause havoc? It causes increased homocysteine level, and this homocysteine is a procoagulant state. It causes the blood to thicken up and coagulate, and causes a host of cardiovascular and other risk factors. Secondly, it causes damage to the vessels also, and it causes hemorrhagic stroke. Neurological problem, there are far many. Peripheral neuropathy, in which the hands, legs get the problem. Cognitive central neuropathy, in which what is happening that there is the poor concentration, poor calculation, poor correlation, and to when it is very difficult, the recall and awareness also get affected. So it has got multiple effects. In severe deficiency, with if there is the disorder of absorption, it causes very severe deficiency. If there is intake deficiency plus the absorption problem, mostly it causes pernicious anemia. It is a very severe state. They have got very debilitating life events. So what does it do? It causes macrocytosis. RBC is more than 100 femtoliter. It is far earlier than the anemia actually, and in anemia it is the large RBCs. Then after, when it is too severe, it causes thrombocytopenia, and particularly in the conditions when you don't know the causes, this is one of the replaceable cause of thrombocytopenia. Neurologic manifestation, paresthesia, in which we feel that something is ringing on you, you feel a sensation when it is not, or when it is causing the sensation when you feel that something else is happening, as if the ants are climbing on your hands and like that. Ataxia, you are unable to stand straight, you don't feel the ground, and you have got disbalance. Cognitive impairment, in which you are unable to understand and calculate to your optimum level without the any problem. Dementia, particularly in old people, they are unable to remember, and if this is the in old people in dementia, B12 is one of the very reversible cause of this illness. So in these people, dementia is common. Osteoporosis, it causes. Fracture risk is due to D3 and calcium deficiency. Cardiovascular risk, I have explained. Hyperhomocysteine level causes increased clogging and IHD and sudden cardiac death in this subset of people. Thyroid dysfunction, iodine deficiency causes goiter and hypothyroidism. Hypothyroidism increases the cardiovascular risk, and there is a host of vitiating problems which can be treated. Immune deficiency, zinc causes immune dysfunction, particularly IgG synthesis, and it causes poor the humoral immunity and more risk for infection. Growth issues, particularly in children, there is stunted growth, developmental delay, poor dentition, delayed closure of the uh, cranium tavis, and other things. Weakness, again, cranial suture delayed closure is the very easy manifestation. It can be identified in the community level. Fatigue and weakness, these are quite common with these patients, and if they are identified, they benefit with that. Actually, I have used the word patient, but these people are not exactly patient. They are the community members who are suffering, but unless we identify and treat them, they will not come to us. Vulnerable population, there are pregnant women, breastfeeding women, they have got if they are deficient, the supplement to the newborn and infant is far less, and they are suffering the problem. If they are replaced enough, definitely the growth and maturation of these babies will be at the reasonable level. Infant and young children, there is critical growth phase. Their supplementation is of paramount importance. They must be supplemented, identified, and treated. Adolescent, as the children mature to the adolescence, they are growing to become men and women in which the use of micronutrients as well as the D3 with vitamin E, they are of paramount importance. If it is not there, the thalarchy, andrarchy, and other things, menarche, all are somehow or other affected. And most of them can be treated with adequate nutrition. Elderly people, they have got multiple challenges. The food of their choice is often not available. There is dentition problem, edentulous people. There are people who have got poor denture, people who have got suboptimal intake, and the people who have got averse to enough eating for social or other reasons. These are the people who have got more the chances of the vulnerability, and they are at high risk. They should be identified and treated. The people of GI disorders, particularly malabsorption syndromes, ulcerative colitis, and others, but the common treatable cause of this group is also worms and amoebiasis, GIDSs, which are treatable with a few tablets for a few days, unless it is identified, told, and prescribed, and they adhere. This, even if the innocuous cause the public health deficit. Paradoxical health risk, what is happening? The people who are taking refined grain are more risk of type 2 diabetes. High sodium food intakes have got hypertension. Cardiovascular ultra processed food intake and association has been already established in neurology studies that they have got increased chances of IHD and sudden cardiac death. So these are the people they need to be identified. Hemorrhagic stroke is far, far more in the B12 deficiency stage, as I have told, by the homocysteine pathway, as well as endothelial dysfunction, and further to weakness of the very aneurysm and other manifestation of the cerebral vessels. So these are the ones they have to be given adequate so that this preventable catastrophe is under control. Hypertension, particularly sodium preserved foods, particularly people who take the concentrated legumes for the cooking in when the vegetables are not there, or brine related pickles, these people have got the more chances of hypertension, and this can be prevented. Bioavailability challenge of this micronutrient. Pure vegetarianism relates to poor mineral absorption. Particularly, they depend on the broccoli, they depend on the cauliflower, cabbages. They all cause the reduced intake of the uh, uh, essential minerals, and they cause problem. Oxalate particularly compete with the calcium absorption. People who are taking lot of the fruits and the citrate containing one, oxalate containing fruits, particularly in the uh, tribal areas, they tend to have poor calcium absorption and face problem. Beta carotene to retinol conversion is again affected in vegetarianism, and again with this leading to low vitamin A availability, ocular and skin related manifestation, particularly dry skin and otherwise. The ALA conversion due to poor essential fatty acid and things. What we have noted, 8% people in the pure vegetarian group have got adequate EPA and DHA, that is dihydroxy acetate levels, and the phytic acid levels are there. Means this there are only 92% people are deficient. So this is the challenge. We have to address it. So how to assess the clinical one? We have already seen what are the manifestations. We have to do the lab test. In lab test, what we find, the macrocytosis, RBC more than 105 FL, Again, anemia in the late conditions, HB low, B12 level and methyl malonic acid. B12 level can be assessed by the commercial kits. Methyl malonic acid rises when B12 level falls, and it is a more sensitive marker. Means that before the low B12, even methyl malonic acid, if it is high, they tend that this person has got vegetarianism and tending towards the B12 deficiency. Serum urinary iodine, very doable thing, and it can be supplemented and very easily done. Iron related studies, ferritin, TIBC, both are very sensitive, and if there is associated with the vegetarianism, it can be supplemented or the person can be counseled about the dietary changes. Calcium, phosphorus, and D3, they interplay with each other, and that is why they have to be assessed together, all three. And if there is the problem, they had to be identified and treated. Unless this interplay the factors is maintained, they will have the deficiency and the problem. Zinc selenium level again are available commercially, they can be done. Plasma homocysteine level again availability. If the plasma homocysteine level is high and the B12 is low, we can definitely treat it along with the folic acid also. There are a group of people who are got the genetic modification, genetic defect in which their high homocysteine levels are there. For these people, the further more supplementation is warranted. Bone marrow mineral density, particularly DEXA scans, are available for public health, screening, and treatment purposes. With that, the adequate osteopenia can be found out in the population-based studies, and the population-based intervention as well as individual intervention can be offered. So, what to supplement? Supplementing is the B12. B12, how much? At least 2.4 microgram per day, or if you have to do with the monthly injection regime, 1000 microgram monthly is warranted. Vitamin D3, 1000 to 2000 international unit, 400 milliequivalent fortified milk. If the people are taking enough milk, because for that you have to require at least a liter of milk for years to maintain your good health, which is quite challenging. Calcium again is required to be supplemented either by fortification or by therapeutic means. The calcium fortification is again challenge because very few ingredients can be accommodated in this, and that is why we more to depend on the supplement. The supplement is easier, doable, individualistic rather than the fortification, which is a public health measure, and to achieving the level is far challenging. Iodine, iodine is 150 mics, and mostly there are the seaweeds, weed soups, in certain places weed tea. These are the things available, but more they are fanciful to available to the rich and famous, not for the public health measure. The best is the supplement of the iodized salt, which is far convenient. Other thing, iron, monitor levels, and if deficient, we have to do two things. Oral supplementation only work unless the phytate reduction is there. The one of the phytate reduction is that you stop the iron tablets with the tea and increase with something citrus, such as limbu pani or the vitamin C. That will increase the absorption. Zinc again 11 mics in fortified food it can be given, but the people who are truly deficient needs to be given in therapeutic doses. 50 mg tablets are available, and if you supplement for a week or 2 weeks, generally the deficiency is over, and then after you can supplement on weekly basis, and they have got the good result. Omega 3 algae based products are available, and they are pearls, can be swallowed very easily, and it helps a lot. Riboflavin, the richest source is the dairy products, and it is can be further be fortified with the additional supplementation and with the public health measure. But the people who have got deficient, they are glossitis, chiliosis, they have to be given orally for longer period of time, as high as 4 milligram per kg body weight, so that their glossitis ileosis, and the roughness of the tongue is gets over. So it is by public health measure, the treatment is difficult, but supplementing for the prevention is possible. Dietary optimization. One of the simplest way to reduce phytate is the washing and soaking the legumes and grains. If you do it, lot of phytates are washed away. Some of the studies have shown that 26% of the phytate content reduction is achieved by simple soaking of the dal and the cereals. Vitamin rich C rich fruits, particularly they enhance the iron absorption. One of the very common is Indian gooseberry amla. If it is taken, it improves your general health. It maintains the acidity, further to increase the antioxidants and further to increase the iron also. So it has got multiple benefit. Fortified plant milks and cereals, these are possible. Soya milk fortification program in which B12 is there, but again, soya milk is used by very rich and famous. It is far costlier, very limited availability. Vitamin D supplementation only through the fortification is far challenging situation in the view of the rampant problem we face every day. Diverse plant sources, you have to mix the things. What is happening? The whole grains are good in the proteins, they are good in the carbohydrates, legumes have got good in the proteins, nuts have got the essential fatty acids, there are seeds, pumpkin seeds which has got high DHEA, green leafy vegetable again the antioxidants. Unless we have to balance all three, it has to be carefully planned that all things have to be mixed for by a vegetarian to have adequate nutrition. What is the way out? The way out is the registered dietitian consultation. Anybody, mummy, nani, and they have got limited knowledge. They have got limited access to the scientific literature. They are not very conversant in the mixing and cooking practices which can be offered on in the long term basis. Regular monitoring is very important. Unless you monitor whether you have replaced or is still deficient, you don't know. Unless you know, you can't do it. So that is why monitoring is very important. And the people who have want to have optimal health, the best way is you come to a doctor, do the necessary tests, including clinical examination and the follow-up. Informed decision, the benefit and risk has to be discussed. I have talked about the challenges. I don't say that there is no benefit of the vegetarianism, but the benefit versus risk in the individual capacity has to be explained. If a nanogerian 90 years old person is told that dementia can be prevented with the yeast-based B12, it is far challenging. So that is why individualistic way, children, the lactating mothers, they have to be informed, the risks and challenges be explained, and then after that. Supplementation compliance is for the long term adherence has to be assessed when they come for the medical checkups, and when they are having this problem, if there is adequate supplementation is offered, definitely it can do with that, and they can continue with the vegetarianism if the supplements are enough. A special consideration with the lactating and the pregnant women is that offsprings have got irreversible neurological damage. They have got the poor myelination and the poor brain functions. So that is why these people require a special care. B12 deficient mother will have got very challenging baby and otherwise. So why not a preventable disease be contained? Iron supplementation is very important because she has to be given adequate iron supplementation. Pure vegetarianism may not be sufficient. With the phytates, further to less absorption, the supplement with vitamin C is far important to meet the increased demand. Calcium enhanced, particularly in the pregnancy, it is the practice that they give lot of milk, and milk, if it is fortified by the calcium and D3, definitely it can work. Folic acid supplementation and plant-based diet consideration are the challenge we face, but mostly These are very cheap available public health measures, but unless we explain, we monitor, and frequently we address by the balancing and otherwise, it will not fetch the desired result. Children and adolescents high nutrient requirement, because the per kg body weight requirement ranges from 30 to 35 kilocalorie per kg body weight. Then after the, based on that, the metabolism again, this vitamin requirement increases, and this makes them vulnerable for the illnesses. So what is there? There is lot many 55% biotic community, particularly tribals who believe in the only organic and local things. They have got this deficiency. Further to in the children, it is higher. So what they have proposed, unless they are supplemented, the optimal health is far, far difficult. Zinc and iodine are critical for cognition development. They must be offered enough so that they benefit. Calcium is essential for the bone health and accrual during the adolescence. So these all needs to be adequately replaced so that the children are benefited. The key research finding, that is that 50% of the vegans have got B12 deficiency indicators. And you see how high is that? Vegans have significantly low vitamin D3, iodine, and selenium. They have got 25% increased risk of vegetarian and the stroke compared to the other people. People who are having mixed diet or having the non-vegetarian diet. And this homocysteine link has been proved beyond doubt. Unless it is supplemented and monitored, this risk remains. Bone fracture again increased if unless carefully planned diets are offered to these people. And once elderly people are there and bone fractures, they are catastrophic. Many lead to death. The evidence-based clinical research has got very important clinical recommendation. You understand? So pure vegetarian is not inherently harmful if well planned and monitored. This is the key point. If people are shifting to vegetarianism, it is good. It has got 100 benefits. But unless you plan and monitor, the desired results can be suboptimal. Mandatory supplementation of these three, B12, vitamin D, and iodine, is far, far important. Regular lab monitoring is important, and annual assessment can definitely ensure the good health. Ultra processed plant based foods are the causes of CVD and cardiovascular diseases and diabetes. These are discouraged, and the whole grain atta flour and the maida should be discouraged. The whole grain products should be there. Adding of uh, millets has further to reduce the risk. So that is there. If the vegetarianism and plan is there, it is far superior than the vegetarianism alone. What is the physician role? My whole aim of teaching my postgraduate is you have to screen for the symptoms during routine examination. The moment you find the strict vegetarian or the long standing vegetarian, you ask for the symptoms and do the directed test. Advocate dietitian consultation and supplementation. You have understood 55% in microbiota group. There are a lot many studies which has come to that. I have given the references. I will happy to say my the references to anybody requiring it. Educate on bioavailability and dietary optimization. Bioavailability is important. Phytate reduction, mixing the food with the most bioavailable elements. These are all possible. These are the public health measures and low cost, no cost measures which can improve the health. A special vigilance in the vulnerable group, children, pregnant women, and elderly people. They are the ones who have got very big challenge and they are at the risk of the problem. What is the clinical case discussion framework when the patient is come? We have to assess the dietary composition and duration of vegetarianism. Longer, the more risk. Review the supplement practices and compliance. We have to see dal if it is soaked, the rice is ultra fine, the flour is wholesome or it is only refined. These are the things you have to understand. Evaluate the symptoms. These are the symptoms you have to evaluate. And most of the subtle symptom is the bowing, knock knee. These are the things you can very easily identify. Even the increase of the wrist diameter. These are the things you can very easily identify. Secondly, hematologic, you can identify the ferritin level and otherwise. Neurologic findings, ataxia, dorsal column involvement, these can be identified by any trained physician in its OPD. Develop individualistic management plan. It cannot be community based. You have to understand whether you are staying with the family, you are staying alone, are you hotel dependent, can you cook, what is the dietary practices you can adopt. These all has to be incorporated, and then monitoring plan has to be offered to the person. The key takeaway is that vegetarianism requires careful planning and supplementation. It is not the God will do it. Somebody trained, somebody understanding, having the scientific background, temperament to help. All this, if they amalgamate, then the desired result will be there. Multiple critical micronutrient deficiencies are possible. I have explained how, when, and how much. Vulnerable population require intensive monitoring, and that is why we are identifying and emphasizing in this class that how best. Informed patient counseling is very important. The patient must be told you are having this problem. You have to adopt to the practices which can help to you. B12 supplementation is not negotiable. It is 3 star. If there is the vegetarianism, the B12 has to be replaced because 55% in the group, 70% in the group. Again, DHEA, the problem is that DHEA's estimation and things are quite different, but this has got a very high public health measure. Regular laboratory monitoring and clinical surveillance is important. It has to be offered, and dietitian consultation is important. Unless this is done, the busy clinician who has got very limited time and energy to address the issue, unless a dedicated person is assigned and he takes it on his or her shoulder, the desired outcomes are very far-fetching. Individual essential is important. That is that many of the people come to our OPD. They ask कि दादाजी का खाना ही तो सभी खाते हैं और बच्चा जो बोलता है वही बनता है. This does not solve the purpose. It has to be individualistic, individual based, and then after, if it is adhered to, then only the desired result will come. I acknowledge my friends, children, and the society members who has given helped me in preparing of this lecture, and I am indebted to that. Thank you. References are available. You can contact me. And evidence-based guideline by a registered dietitian is recommended, and then only the desired result, the optimal result is possible. God bless. Best wishes.